Immunotherapy is currently FDA approved and standard of care for patients with microsatellite-high tumors that are characterized by deficient mismatch repair. And there are several agents approved in the space for multiple tumor types. While a lot of patients have great responses and or have a durable disease control, we do sometimes notice treatment resistance that could be innate or may develop after a period of time. Prior work in some cancers where immunotherapy is very effective, such as in melanoma and urothelial cancer, has suggested that acquired resistance to immunotherapy is associated with increased activity and signaling through the TGF-beta pathway. So TGF-beta pathway is thought to be immunosuppressive and inhibits response to immunotherapy in patients. So building on these data, Bintrafusp alfa was developed. This is a bifunctional fusion protein that fuses the extracellular domain of the TGF-beta receptor, so that acts as a TGF-beta trap and soaks up all the TGF-beta that is in the microenvironment. And this is fused to a human Ig1 monoclonal antibody, so that blocks PD-L1. So the hope is that you're combining an immunotherapy agent with a TGF-beta trap, so thereby kind of improving the activity. In this phase 2 study, patients with MSI-H metastatic solid tumors who had developed resistance to prior immune checkpoint therapy received this agent, Bintrafusp alfa. The drug was dosed at 1,200 milligrams IV every 14 days. The primary endpoint was response rate, and other key endpoints included progression-free survival and overall survival, in addition to toxicity. 15 patients were enrolled. The vast majority were colorectal, with a smattering of other tumor types. There were no responses noted in this cohort of patients. Overall, the median progression-free survival and overall survival were 1.8 months and about a little over 9 months, respectively. And the disease control rate was about 21%. So overall, the study, unfortunately, did not show activity as was anticipated. But there are several correlative studies ongoing through blood-based and tissue-based evaluations that could shed more light in terms of why we did not see anticipated activity that could lead to other studies in the future.